Steve?
You mentioned a couple things about, I guess I just have a comment about government in general and my disappointment about how things are being run on the federal level, and it's no secret to anybody in here, but you mentioned the backroom deals with Senator Nelson. We talk about a lot about Cadillac, the Senate version of health plans going to tax Cadillac health plans. Well, at Midwest Minerals, we are a Cadillac health plan. It's not because of benefits. It's because our employees are, very blue collar, not the healthiest group in the world, and thus it drives their rates higher. So, I guess I've been fairly antagonistic to the whole process, but I think what happened in the last couple of days just really catches me. I'm very bewildered in that we have a process that it's not law, but it's a process that the House and the Senate go through in passing a bill. And the majority has chosen not to go to conference committee, not to include both sides at the table and the debate. I guess what are your thoughts on that whole procedure? Is it just that they don't care, or they're not wanting to talk about the things that are not right in this bill, or they just don't care about the people of the United States of America?
I hate to suggest that they don't care about the people of the United States of America, but the evidence is not very clear that they do, at least the Americans that I talk to. And I mentioned this earlier, but I think the political focus has become passing a bill regardless of what the bill is. It's the headline that says we accomplished what we set out to do. It's the deals, and I'm not naive. I recognize that there are deals struck to pass legislation, but my point is this one is so important that you would think that there would be some higher calling. I think at this point in our country's history, we need elected officials who are going to say, regardless of what it means to me and my folks back home, is this good for America? And the idea that certain states would get preferential treatment, I've asked our Attorney General, if this bill becomes law, they ought to be filing a lawsuit against this legislation on constitutional rights of equal protection. We ought not be paying for Nebraska's Medicaid. And particularly Senator Nelson, I don't mean to single him out, but his objection, at least initially, was that he's not going to support a bill that has taxpayer-funded support for abortion. If he believes, if he's opposed to publicly funded taxpayer-supported abortion, surely getting his constituents' Medicaid payments increased is not the moral answer to his dilemma. Either you believe in what he said he believed in, or you don't. And so there are issues in which you don't barter away your core values, your core system of what you believe, and you don't do it on a bill that's going to impact Americans in such a broad way. This is not an appropriation bill in which things are tacked on. That's bad enough. But this is something of substantive policy that's going to change health care for every American. And so I'm troubled also, as you say, by there's no conference committee. When I was in the state Senate, conference committees were where legislation really was worked out, and it was done in a pretty good way of trying to figure out what the right answer is. A conference committee is made up of in the House and Senate, the leaders of the House, the leaders of the Senate. They sit down and work out the differences between the House-passed version and the Senate-passed version. Here they're not going to do that. They're going to just try to resolve it among themselves. Brian Lamb of C-SPAN asked this past week for the House leadership to put the proceedings of the health care negotiations, these final negotiations, on his program, on C-SPAN. Let Americans see the debate. President Obama, candidate Obama, talked about that in his race for the presidency. And whether it's a Republican or a Democrat is irrelevant to me. Having some level of understanding of what's in a 2,000-page bill in the House and a 1,900-page bill I said that differently, in the House and in the Senate, and then working out the differences, and we're going to find out about them sometime a year from now as to what really was in the bill. It just seems to me that Washington has lost touch with what's important to the country. It's not about getting something passed, it's about trying to take care of Americans. And the whole focus is in Washington is, what the Democrat leadership would say, in deference to my sliding Democrat, is that, well, the Republicans are so much obstructionist that if we put this up for full discussion, we'd have a whole bunch of procedural votes and this thing would drag out forever. Again, in the state legislature, we all came together and worked out the differences and came up with a bill that was broadly supported. It didn't happen very often with Republican days, and it doesn't happen with Democrat days. It's now just do it and ram our way through. People keep asking me what it is that Washington doesn't get. If there's so many Americans opposed to this, why is it passing? And I don't have a great answer for that, except it just seems to me they want to pass something so they can say they had the victory. And it appeals to a certain segment of Democrat voters who they campaign to that say we're going to take care of health care. And again, I think there's many people in Washington, D.C. who are just afraid to have a conversation with their constituents or don't know what